I am tired. I had a long Monday.
Oh,
Wow.
dude, you had a long weekend. You had a long Monday, all that. Really appreciate you taking the time to join us here. You good?
Yeah, no, totally.
All
It's
right.
always fun talking to you.
See, this is what you need. Everyone thinks this is water.
Here with a bowl of M&Ms because I had to work through lunch. So,
so you're gonna have a sugar high and then you're gonna crash. All right.
that's the real dental treat. There is. You know what
You're
I mean?
a dentist and you're sitting there eating. M&Ms for lunch. I love
We
it.
get down on M&Ms. M&Ms are like the lifeblood of our practice.
Wait, hold on. Are they peanut M&Ms? That's the question.
They are peanut M&Ms.
Oh, right on. So
And
first of all,
let's
hey,
hear it.
thank you for joining us. Hey, everybody. Welcome to Dental Voice Season 2. Today, we get to talk to Dr. Brian Baliwas, who is one of the dentists I personally am really excited to speak to. And the reason is we know each other, or we met each other like a bazillion years ago, right?
Yeah, I remember that. That was in Chicago midwinter. When was that? I think that was the last time they had it, right?
I think it was 3 or 4 years ago. We were in line. And there was this massive line, and you were coming over there, and you were representing, or you were so excited about social media and dentistry. And we're like, what's this guy talking about? Remember that?
I remember big time.
And look at you now. I love it. I love it when things turn out good. I love it when things go. So take us through that. First of all, how are you doing, and how are things? I mean,
things have been good. You know, it's interesting. We all ask each other, hey, how are you doing? How are you holding up? And when we reply good or I'm doing fine, it starts to transition us towards like this new, what I say, normal, right? But I'd say, yeah, we're doing good. We're adjusting. You know, we've got PPE in the office. We've got protocols in place. We have, most importantly, we've got staff who feel safe. And then also just as important, we have patients who feel safe. So things have been good. We were just kind of cruising along, trying to navigate our way through all of this.
It's amazing to think that in the span of several months, everything as we know it is completely thrown on its ear, and we're having to change, and literally every day we're learning all sorts of new things. How do you personally separate what you're hearing versus what you're actually implementing in your practice?
You know what's interesting is, and I don't know if, hold on, let me turn this music down. I would say that we're at a point right now where if somebody told you, you know what, we're only doing what the science says, and I'd say that that person has no idea what they're talking about. Because I still think, yeah, I still think we're in this position right now where we're doing the most we can because we don't know. You know what I mean? Like, right now, even you take something like a mask. Everybody's like, well, I want to wear an N95. And we were wearing surgical masks for decades. And those surgical masks, not everybody was even wearing level 3s, right? There were some offices who this was the catalyst for them going, there's different types of masks.
Oh, crap.
Right? And what's interesting is, you know, there were airborne diseases like tuberculosis, right? That were aerosolized and whatnot. And my thing is right now, we're all doing what we can. And when we do something, it's either to make ourselves feel better, or it's kind of overkill to make sure that we have our bases covered, or we do find some science in it that says, you know what, I think that may connect to this, or I think this covers this, you know? But I believe we're still in this, we're doing more, or at least we're urging people to do more than we actually know.
And that's what I think what makes people feel so apprehensive, because now we're operating on what we think is supposed to what we know. You don't seem to be even the slightest bit funky about that. How come?
You know, it's interesting. I'm trying not to get too political, right? But we're American, right? So like, it's funny. You hear this on the news. You see people who are like, you know what? I have the freedom to do what I want. But there's this like gray area of, look, like, yes, I personally believe it's everybody's right to not have to wear a mask if they don't want to. Just like if you don't want to wear a seatbelt, believe it or not, and this will cause some controversy, I don't think it should be forced upon you. But you better suffer the consequences, right? And the interesting thing about masks per se, you know, it's not for yourself, it's for other people. And what is it to you, you know? So it's this little gray area of what is the true inconvenience of that, of doing that kind of stuff. So that kind of connects to dentistry where, you know, a new product might come out, you know, a new procedure, a new protocol. And we've got to say that even if that science isn't there, well, what's the cost, right? Because if it's not a lot and it's not that much effort to implement, I'm kind of on the, well, you know, let's do it until we know more, right? I'm trying to fall on the right side of things. So that way, you know, if something bad were to happen, I'm not saying, man, I wish we did this. Do you know what I mean? I'd rather say, you know, in the future when they go, hey, by the way, that wasn't doing anything, I want to say, well, at least I cared enough to do it.
You know, what I hear with what you're saying, and it resonates very strongly with me, is it's better to do something than to just sit there and do nothing.
Yeah.
Because when you do nothing, you basically have done nothing.
Exactly. You know, it's funny. Like if we were standing in the middle of the street and somebody came running down the street and they were like, run, there's a dinosaur headed our way. I'd look at you, I'd go, what the heck is that person talking about? Now, if another person did it and then another person, I might look at you and go, you know what? Let's just run. At the very least, we might come to the end of the block and look back and go, well, that was stupid. Like you know, it was a prank or whatever. But the cost benefit there of us not running and getting eaten by a dinosaur might, you know, I just don't want to take that risk. Does that make sense?
Yeah, I mean, one or two, all of a sudden, 100 people going, there's a dinosaur. You're like, you know what? I don't want to test this. I'm out of here. So check this out. The big issue that we have is that there is so much talk about so many things that people aren't quite sure what things to deal with. And unlike the metaphor that you, Bruce, it's not just one person or 100 people. Each of them is saying something different. One thing that is consistent are aerosols, right?
Yeah.
Aerosols, and even lately we're seeing things that aerosols definitely can or potentially have the ability to carry airborne things, bad things. I'm just going to call it that. Viruses, bacteria, that type of thing, right? Tuberculosis, whatever. Now, negative pressure rooms have been the standard in hospitals forever. And then now, you know, there was a lot of talk about it in dentistry, and then, then there isn't. What are your thoughts about this whole issue of negative pressure rooms?
You know, it's interesting. I'm one of these people that says, you know, aerosols have been around. It's not like all of a sudden aerosols have been created because of COVID. You know, aerosols are here. We've been dealing with them. And again, I think that it's a wide range of things. When we consider what do dentists do for safety, it isn't one end of the spectrum of doing nothing, and it isn't the other side of the spectrum where we're doing everything. And it isn't so much, here's what we should be doing. There's a wide range of different types of practices and people and how they operate. And I think what we're trying to do is swing that. We're trying to operate within the bell curve, right, of where things should be. And so that being said, I think that, you know, again, I'm trying not to offend anyone
hey, it's okay.
You know what I mean? but COVID happens, and then, you know, I was getting a lot of people going, hey, are you wiping everything down in the room, or are you like clearing off your countertops? And I'm like, you know, if you had asked me that last year, my answer would be yes. It's not just because of COVID, right? Like, there are other aerosolized diseases. Mind you, right now, COVID is, in my opinion, rampant and it's around there. But again, it's like we should find out what our standard is universally. That's why it used to be called universal precautions, right? Or like, let's protect from everything and then make that our baseline. And then if there's specifics, we should go from there. And so when you say, oh, you know, these negative pressure rooms, that's where I'd like to find out the science and have people bring up like, oh, what are the trends? Like, have there been links to COVID being spread through a dental office, being passed? And even though those aerosols exist, the other thing that exists in our office is PPE, right? So a lot of people were saying, oh man, dentists are so high risk. You guys are in close proximity. You guys generate aerosols. You guys see a lot of people. And I go, yeah, but are we doing things there? You know, analyzing risk is always a seesaw. There's factors that cause it and factors that protect you against it. So where are we on that seesaw? And I would say that, you know, with practices that were really following proper PPE, had good sterilization, disinfection protocols in the past, this change of how much we have to do now isn't that big of a deal. Does that make sense? It's like we've had to do some extra things. Whereas for some practices, it's the end of the world. I've got to do what? I've got to wear a mask and I've got to do this. And so I don't think there's a specific answer, if that makes any sense. It's you know, we try to do what's best, and you know, where did we lie in that range of protecting ourselves? Does that make sense? I don't know if that completely makes sense.
Totally. It's a function of what you believe and what you're willing to put your energy in. I like the reference you made, which is, you know, dentistry has had PPE, has had infection control, and you can kind of see the people who've been doing it on a regular basis, they're just doing more, and then the people going, wait a minute, we have to wipe everything down, and it kind of makes you think, you didn't before? So
exactly,
kind of that context is there. How do you see now? When we met you, you know, back a bazillion years ago, when I was much younger, actually.
you look just as young.
Oh yeah, all right.
I think we're the same age.
Oh, there you go. Ooh, I love it. And you were talking about social media. This guy talking about, how do you see that affecting the ability to communicate all these things that you're talking about to people, to the message around what you are, or are you using it for COVID?
You know what? I think it has a huge effect, not just on COVID, but just how we practice in general. And I would say it's good and it's bad. And it's good and it's bad for the same reasons, which is information passes super quickly, just like this. You know what I mean? Like tomorrow I could, you know, anyone with a platform could post anything they want, and that could either be accepted or declined, or it could just morph into anything you want. So if it's something good and science-based, awesome. If it's not, you know, if you wanted to, I don't know, hold an office in the government and start a Twitter page and just say whatever you wanted, then no, just it could be anybody in office who has a Twitter page. It just gets passed on, and again, these days with social media, I think I talked to you about this a little bit. There's, you know, cancel culture and call out culture. People don't think. They don't see a post and say, let me research this and think about it before I repost it or react. When people see a post, they react. They go, I need to like, I need to comment, I need to share, I need to agree, I need to disagree, I need to put my foot down, and I got to call in the troops, and let me make sure there's other people who think just like me. So that being said, it's good and it's bad. I think social media has a huge role in this, and I think social media is actually in its early stages because it's still evolving. And I think it needs to find the ethics of it, if that makes any sense. You know, there was a time in the past where cocaine was put into soda, and it was used as a drug to numb people.
Coca-Cola?
Yeah, and then we kind of figured out, from an ethics standpoint and from a use and what this is turning into, we should probably throttle that a little bit and not do that, right? Social media is kind of the same way. We're in these early stages and people are using it to do all sorts of stuff. I mean, I've used it to build a practice. Companies use it to sell products. Dentists use it to promote themselves. But then pretty soon we've got to start figuring out what's right, what's wrong, what's not allowed.
Yeah, it's such a good point too, because you're right. There is little validation that occurs because of the speed and the fact that you want to jump on it really quickly. So people, it's almost gotten to the point where you see something and people are responding like, oh, that must be real because it's on. So that is interesting. I like I like the way you think. There's a provocativeness around the way you think, because you're not just looking at it from one, you're kind of looking at it from a bunch of different directions.
You have to. You have to. You have to take a step back and like kind of look at the situation. Another great analogy for what's going on now is what happened with the AIDS epidemic. And, you know, I wasn't around for that, or I wasn't a dentist back then, but I've heard stories about what went on. And if you look at that, that kind of sparked the era of us as dentists using gloves and masks and protecting ourselves, right? Well, what's interesting is after the AIDS epidemic ceased from being an epidemic, did doctors and dentists all of a sudden say, oh, well, thank God that's over. Let me take off my gloves and let me go back to where I was starting. So we took from that and improved our protocols and what we do to protect ourselves, our patients, and our staff. So instead of being so focused on COVID specifically, you know, there's people who are like, oh, well, you're wearing a mask, you know, COVID particles are this big and they can shoot through there, and oh, did you know that it's aerosolized? Oh, did you know it's found in droplets? Oh, how about we take a step back and go, what are we doing as a profession to protect ourselves, our patients, and our staffs from everything, right? Not just COVID, but what could happen in the future. And that's where that provocative thing you're talking about, because it's so easy to fall in the trap of like, this is what's going on in the news. This is the hip thing. I don't know. We gotta think a little bit. You know what I mean?
Yeah, and because there's a lot of emotion out there.
Emotions.
And when you think about emotions are very visceral, and they just come out, and people are doing that. What are you currently doing in your practice beyond PPE to be safe?
That's good. Good little analogy there. There's this idea of there's this pyramid that kind of talks about mitigating risk in your practice, and at the top of this pyramid is actually eliminating risk. So the best thing you can do is right now, if you could snap your fingers and get rid of COVID, then congrats. That's the best thing. No one can do that, right? Underneath this is layers. And so you start getting into, look, if you can't get rid of it, can you separate yourself from it, right? Hence social distancing, that kind of thing. Screening patients, right? Kind of trying to get risk factors. And as you get lower in the pyramid, the percentage of how accurate and helpful that is goes down, right? So, you know, getting rid of it, awesome. Screening patients and asking them questions, well, you know, some people slip through the cracks, right? Some people are asymptomatic, yada, yada, yada. But as you go down, all of a sudden you start going, okay, what can we control at the office level? What about our staff? Can we practice a certain way? Can we keep things routine? Can we start doing rinses, pre-rinses, right? Which we've been doing. I used to do that before I place implants. Kind of makes sense that if we can clean somebody's mouth before we start aerosolizing whatever's in their mouth.
Right.
Even if they didn't have COVID, if they just had a cold, again, sounds kind of like a good idea to kind of sterilize their mouth before I kick stuff up in the air. And then as you go along, at the very bottom of this pyramid is PPE, right? So what's interesting is everybody is so concerned about the PPE, but it really does the least amount for us. It's kind of like the last line of defense. At the very least, so our big focus isn't so much on our PPE, but for our PPE, we do have N95 masks,
Right.
face shields. We actually use reusable gowns. We have a washing machine at the office, luckily. So we're doing all that. But as we kind of climb up the pyramid, we're really focused on what can we do to minimize our exposure and risk. So, you know, we try to limit how many patients are in the room or in the office. We're screening patients, making sure that, you know, even if somebody says, oh, I just took a trip to Mexico, I feel fine. That's awesome. Let's just see you in 2 weeks. It's not a big deal. Chances are, if we roll those dice, nothing's going to happen, right? Like, that's where I would put my money. Is there a chance that something could happen? Yes. Again, risk reward. If something happens, what happens? We shut down. I have to contact all the patients who were in that day and beyond and say, hey, by the way, there's a chance that now I'm doing tracing. I haven't heard of any doctor's offices or dentist offices that have been kind of like a hub or a, I forget the term they have for that, but
A
a super
vector.
spreader, office, right? And I don't want to be the first to be on the news. Do you know what I mean?
Yeah. Oh, yeah.
Local dentist in San Francisco, super spreader office. Like, no thanks.
That's
So when we weigh the risk reward, I would rather just wait, right? And I'm fortunate to have a patient base that is honest with me. I'm not churning through patients. I'm not seeing 30 patients in a day. These are people who I have relationships with, who understand the protocols, who don't give us a hard time when we're taking a pulse ox or a temperature, or we're asking them to wear their mask before we walk them up. We just don't need that. If somebody's going to give us a hard time, they're gone. And so that's our focus. Our focus is making sure that we're keeping people safe, keeping the staff safe, and then also making sure that me and the staff, the other doctors, hygienists, are being responsible. I'm not hosting COVID parties at my place. I'm not eating at busy restaurants. I'm not eating
right.
indoors right now.
Yeah, you're not exposing, right?
Yeah, and again, that's not 100%. There is a chance, knock on wood, that I could just be walking down the street and the wrong gust of wind happens to carry enough COVID particles that I get affected. But it's all a numbers game. You know what I mean?
Yeah, yeah. So are there systems that you have in place in your office to try to minimize that, aerosols or any of that type of stuff?
Yeah, so this is where we start getting into, does it work, right? I've always been a big rubber dam person. We talked about this, that before Zyris was Zyris, it was dry, Isolite.
Right.
And actually, when I was a student, gosh, so I graduated 6 years ago, but it was my second year that I won. No, it wasn't my second year. Anywho, I won a competition at the school, like a clinical excellence day. I think it was for aesthetic dentistry, and I won an IsoDry. And I remember introducing it to the office right when I first got hired, and we've been practicing with them since. And so that's one way that reduces aerosols. But Kois has brought up that even just having the HVE right over the aerosolizing whatever you're using, handpiece, Cavitron, whatever, reduces it a ton, right? And then, do we have to do those procedures? So can we hand scale if we can? Can we avoid polishing? Although, again, from a polishing standpoint, in my mind, that's droplet and not aerosol. I mean, I'm sure it aerosolizes a little bit, but really what you're doing is flicking little pieces of prophy paste everywhere. So that's a little controversial. I'll probably get some DMs from hygienists right now going, it aerosolizes. Hand pieces, we try to minimize that. And then we try to open the windows when we can. And then we have a lot of air filters. Again, not to catch COVID, because a lot of people will say, well, COVID's so small, it's not going to get, what kind of filter do you have? It's about moving air, not letting things be stagnant.
There you go.
With any kind of disease, bacterial, viral, it's all about the load and time, right? Like how much of the virus is around and how long are you exposed to it? And if you can kind of move that stuff around, I mean, we're doing what we can. What else are we doing at the office? Sneeze guards up front, just the typical stuff where I would love, this will never happen, but I'd love to see a study somehow that says, like, do the sneeze guards when you check out protect anything? I don't know. I would think that if somebody were to sneeze, then yes. But just being there, I'm curious how that works.
So I'm curious because first of all, I do remember when you won that system, and we've been told, or there are other clinicians who do like our system, and they mentioned something about it creates a negative pressure area inside the mouth, so that it's intercepting. Do you believe that? What are your thoughts on that?
What's interesting, and I'm really upset that they never got this off the ground. If you reach out to Jesse Valet, and I believe Faroud Hakim, they were trying to do a study where they were measuring the humidity around teeth using nothing, using a rubber dam, and using IsoDry Isolite. And they actually found that it was equivalent to full isolation with a rubber dam in terms of sucking up that air, I guess you could say. Do I believe it? Yeah, I think so. I think it's doing something, right? I mean, it's just physics, right? Like, if you're sucking something up and you can hear it sucking, what is it sucking up? It's sucking up air. Perfect. Where's that air coming from? Well, it's only connected to the mouth. So the only thing I can think of is if there's different jet streams in the mouth that maybe it's causing some, I don't know. But for me, it helps. I mean, we're just really big outside of COVID, outside of all of that, we're big on isolation just so that our dentistry lasts.
Yeah, and that's awesome.
Again, going back to our original point that original thing we were talking about, is this your aha moment to use isolation, COVID, or should you have been using isolation from the very start? You know what I mean?
Really good point. Really good point. You know, it's interesting that you mentioned that. When you finished from school, you went to UOP, is that correct?
I did.
And you started with a group practice, is that right?
Yeah, I did.
And then,
I had 2 jobs,
if I understand correctly, you've transitioned away from groups. What was the logic behind that? I thought that's you're in.
It's funny. Adam Miller and I actually started our own practice, and we always joke around. We are really bad employees. And what I mean by that is like, I want to do things my way, and I want to be responsible for things, and I want to take risks, and I want to fall on my sword. I want to be that guy who says like, look, we're going to do this. We're going to try it. Let's do it. Do you know what I mean? And it's hard to do that when you don't own the practice. No matter how much autonomy you're given, it really, you need that pressure of like, wow, these people are depending on me for jobs. This, there's patients depending on me to keep this thing going. I don't know. We're bad employees. So we decided to go off on our own, and we bought a practice last April. So.
And how's that going?
It is going well, except for those of you guys who weren't tuned in earlier, I'm munching on M&Ms right now because I had to work through lunch. It's busy. Is really busy, but it's going well. I'm learning a ton. And if you've seen my page, I've been sharing a lot of my adventure, kind of with products we bought, things we're doing around the office, things we're learning. I think every little adventure like this is a learning opportunity. And I'll just continue to share what I learn with whoever decides to follow and pay attention.
See, I love the sentiment, and I love the message behind that. Move forward and execute. Do something. If you don't do anything, you don't learn anything, and you're learning, and then you adapt and you move forward from there. And that's basically what you're saying, right?
Yeah. I mean, there's always limitations to things, right? Like,
right.
Zyris could come up with a new device that might decrease humidity and whatever aerosols by X percentage, but it costs $30,000. Man, right? So like, there's always like a give and take. And so you just gotta, you can't be the person who's doing everything, but you gotta be smart. And that's the problem solving that comes with owning a practice is where do we divert our attention? Where do we divert our finances? What is worth it? What's worth exploring? And when do we pull the cord if it's not? Do you need the fogger? Yeah. Come on in.
Is this your partner?
You want to know for? Oh, is it locked?
Oh.
So, if you were wondering, yeah, we fogged the office.
That is cool.
Yeah, my dog loves the fogger. She's like, look at this. She's just like waiting. Here. You see her?
Oh, what kind of dog do you have?
She can't get enough of this thing. Absolutely ridiculous.
That is so awesome. So there are practices out there that are struggling. There are practices that are not going to be opening after this. Here you are, you've gone out on your own, and it sounds like you're successful. You're busy. What
I think we're busy.
advice? What advice would you give those folks who are still struggling in this, who may or may not even have opened up, or if they have, they're not clear about what they do? What advice would you give folks about
I don't
that?
think it's fair to say or evaluate whether you're struggling right now. Although if you're struggling right now, you had 3 months of patients as a backlog of people who need to get in. You should be busy right now, right? So if you're not busy right now, you've got to work on your recall systems. You've got to work on maybe implementing some sort of software that gets patients in the door, or you need to work on making your patients feel comfortable coming in. And if one, you've got to feel comfortable coming in. So do you believe in your protocols? Do you believe it's safe? If you don't, reach out to some people who are open and busy and say, hey, how do you feel? Do you feel safe? Does your staff feel safe? What are you doing to feel safe? Because again, right now, patients should be coming in the door. I mean, we have it right now. If a patient cancels, we go, that's okay. We understand, because we have a long list of people who need to come in, and we'll fill it just like that.
Yeah.
Where it becomes scary is once we get past this backlog. So dentistry always kind of takes a little hit a little later in a recession or a stoppage or something. So as the months go on, and it might not feel that way as we approach November, December, because everybody always likes to get in with their benefits. But it'll be interesting after that, come the January, February, March, how busy we are, especially if this continues on. So I would say right now, my big advice, and this is something Adam and I are doing, we're saving money. We're really trying to budget well. We're trying to break down our budget, understand our P&L. So as a new practice owner, I'll be honest, 6 months ago, if you gave me a P&L, I'd go, cool, is that good? Is that number good? And that number being big, is that negative or positive? I'm not, right? Now, P&L's like, we got to get on it. Like, we got to know where money's going. And then we're kind of trying to build a little nest egg. It's harder for new practices. It kills me. I've heard of a couple colleagues who reached out and they're like, man, this really hit me hard. I'm like, you've been in business for 20 plus years, right?
Yeah.
I mean, how do you not have a little savings, even if it's your personal savings that you have to kick back into the practice? Like, you should have something. So I don't know. It's really taught us about budgeting. And so I hope I'm wrong. I hope that there is no slowdown, but my prediction is that there might be in the future, especially once we start getting caught up with things, and especially if things get worse, knock on wood. So that's my whole thing is we feel comfortable right now, but let's give it some time.
I love the forethought that you have in that, and the fact that the perspective is, hey, now that it's really busy, let's be smart, let's be intelligent about what we're getting here, and let's not just go crazy. To this way, it carries us through the long run. Dude, I could spend hours talking about you. There's so many things that I'd love to, but we've already been on. You've spent so much time with us. Really appreciate that. The logic that you take is based on reality. It's based on belief, but it's also based on what makes sense. So I think that's it's a great perspective, and the idea of making conscious decisions, not just for now, going forward, I think is huge. If you were to wrap this up and kind of give just a message to your viewers, to the people who are following you, or that type of stuff, what would you say to them with regard to, the future is not clear right now, but what?
I'd say the future's not clear right now, but I think we've been all blessed to work in a really awesome field. And it's not a field that's going to go away. Because even during a complete shutdown, I live in the People's Republic of San Francisco, which is the most, am I allowed to say this? The most, insert the word that I want to say right here, place in the world. And I mean, they were putting up restrictions and regulations. I mean, they were shutting the thing down.
Yeah.
But throughout all that, we still had people, patients, and unfortunately, they were in pain or breaking teeth or, you know, and what do? You can't send that person to the hospital. You could, and then what? They get their tooth pulled. They get, you know, there's always going to be some sort of need. And so even during the shutdown, Adam and I were in here. We, you know, we're not too proud to assist each other and kind of, you know, that's what we did. We kind of buckled up and said, look, let's get this done. And so I would say, even though things might get worse, who knows, there's always going to be a need. And I think that we've just got to kind of stick together and kind of share resources. And again, we talked about this earlier with social media. We just have to think a little bit. I mean, it's so easy to post or hear something and then all of a sudden freak out or get angry and have a reaction. And to tell you the truth, I'm pointing the finger at myself, okay? Because a year ago, 2 years ago, I was that guy. Like, I disagreed with somebody and I was like, oh my God, like, I can't believe they posted that. And then I'd have to post. And you know what? Life's too short. Like, you're never going to agree with everyone. So it is what it is. I think the more of us that kind of keep a level head and kind of take a step back and go, what's really going on here? You know, I really believe in social media. I told you that years ago. I think it's the future, but I really don't like the direction it's headed, where it's becoming a tool to kind of rally the mob.
Yeah. That is cool. Thank you for that. I love the fact that you're still munching away at those. You guys
so
need
hungry.
to get some real food and stuff, dude. But by the way, that's me. I can kill a 5-pound bag of trail mix in like 2 days. So, hey, Dr. Brian Baliwas, thank you so much. Thank you so much for joining and taking the time. Really appreciate it. You had a tough day. You didn't even have lunch, and you're munching away, and you still got on. I love the message that you have. At some point here, would you be open to joining us back and sharing how things are going and all that type of stuff? Would that be cool?
And keep a recording, because then if I'm wrong, you can go, hey, by the way, and you play back.
Oh, we can come back.
Look what you said.
You said
that. That's it. Yeah, absolutely.
That is awesome. You
guys are fun.
Thank you so much. Hey, those of you who joined us, thank you so much for joining. This is Dental Voice Season 2. We've got Dr. Brian Baliwas, an incredible person. And, you know, I'm so happy that we met before. I'm so happy that we were able to reconnect, talk about a small world. You are absolutely wonderful. If you like this, guys, share it. If you don't like it, let us know. If you have questions about it, go to him, go to us. What's the best way for people to reach you?
Just DM me. I answer an insane amount of DMs a day, and it's actually me. I always get that question. They're like, do you answer all these personally? I'm like, I do. It's my account.
So there you go. Hey, have a great evening. Please go get something to eat. Please be safe. And, you know, I'm going to call you at some point here and pick your brain and spend some more time. But thank you. And really, really appreciate you coming here, and have a safe, and we'll talk again.
Yeah, perfect.
Awesome. Thank you. Take care. Have a good evening.
Bye.
All right. Bye-bye.